Namaskara, and a very warm welcome to this edition of the Spiral of Wisdom that we have every Thursday at the School of Ancient Wisdom, started by Mama Day. Before we continue, may I request Swati to say the school prayer.
Thank you, sir. Good evening, everyone. O hidden light, vibrant in every atom. O hidden light, shining in every creature. O hidden love, embracing all in oneness. May each who feels himself as one with thee know he is also one with every other. Thank you.
Thank you, Swati. As we're all very aware of this wonderful Theosophical Society prayer that is the school's prayer, when we come in to our satsangs every Thursday, we leave behind the day and our experiences in our outer world, the world around us, and we move into our inner world where we connect with our own higher selves with a higher purpose of personal and spiritual growth. The best way to do that is really to pray to our Guru, the inner Guru, to guide us, to raise our consciousness and keep us in the right space for us to get the maximum value from these satsangs. So please sit straight with your back, neck and head aligned. Take a nice deep breath. And let go. In the silence, center yourself within. And ask your higher self for the best guidance. Through the shloka. Guru Brahma, Guru Vishnu, Guru Devo Maheshwara, Guru Sakshat Parabrahma, Tasmai Sri Gurave Namaha. Once again, a very warm welcome to our Thursday Satsang. I'll be a host for today. My name is Ramesh S.K. And again, as a continuation of what we did last week, we have a very well-known Dr. Kumar Ji, who is our resident doctor for Ayurveda at the School of Ancient Wisdom. Kumar Ji is also working on a lot of research, cutting-edge research, to bring the ancient wisdom of Ayurveda and to understand it better and percolate it amongst the modern world. So he's going to continue the talk that we did last week on Panchakarma, the basics and its relevance for longevity, part 2. So over to you, Dr. Kumarji.
Yeah, very good evening. Am I audible?
Yes, clear.
Very good. So, good evening, one and all. Thank you so much for this platform to deliver, very relevant topics of satsang to understand more about Ayurveda and its Panchakarma. 2 weeks back, I think I've started a class on basics of Panchakarma for today's relevance to understand how Panchakarma can help to detox ourselves and to have longevity. I've started and I've briefed why we need Panchakarma in the last classes and what makes sense for all of us to understand its importance in keeping eye on that how we can have Panchakarma by ourselves, simple things from Panchakarma, and getting into and to have a consultation with the experts of Ayurveda to have Panchakarma program. So last class I stopped here. What is Panchakarma? What is which we call it as Shodhana Chikitsa? So we'll continue and to understand more about Panchakarmas, that is 5 procedure, what we understand. So before we do major procedure, Purva Karma is very important with what we called as preparatory purifications. There also it starts purification and preparing a buffer, proper purification. Then Pradhana Karma is the main purification, how we do, by procedure. Then Paschat Karma, post purification, how we have to care ourselves to see the results of Pradhana Karma. This is what Purva Karma, Pradhana Karma, and Paschat Karma. So we'll see and we'll try to understand one by one. Again, it is not possible for us to deliver in next one class and so, but we need to have one each karma to take one class, make you to understand more on its importance and its application, how you can experience yourself undergoing Panchakarma. Next slide. As I mentioned, Purva Karmas, very important because we are preparing the body and mind for a patient to undergo Panchakarma. Many of our
Is Kumarji there, or have I lost the connection?
many of our patient comes and ask for Panchakarma. They don't understand the procedures and they'll not be knowing, actually, to say awareness is very less among the public, but they heard about the name Panchakarma, so their interest is once we do Panchakarma we'll get detox and we'll become normal like a healthy person. That is their interest. So we have to help them to understand what exactly the Panchakarma is, how we are going to do, and what is Purva Karma before we do Panchakarma. So there itself, the action starts to make them to understand physically and mentally what exactly the Panchakarma is all about. Purva Karma, what we call it is a preparatory purification, is very important. Under that we have three headings or three topics or three procedure. One is Deepana Pachana. What is Deepana Pachana? Improving the digestion. Improving the digestion of the individual is very important. That means we are going to improve the metabolic factor of an individual to prepare them to detoxify. That we call it as Deepana and Pachana. It is having two words. I'm going to explain you in detail what is Deepana, what is Pachana, what are the herbs we are going to use under Deepana, Pachana, how we are going to do everything. Then, Snehana. Once we improve the digestion and metabolism, then oleation we are going to start. Oleation therapy is nothing but giving orally medicated ghee or oil to soften the system and bring all the toxin to gastrointestinal system. It includes, one is internal oleation and another is external oleation. Purpose is simple, lubricates the system externally as well as internally. So this is called as Snehana or oleation therapy. Next is Vedana, sudation therapy. Once we do oleation, it has to be taken out through sweating therapy. Various methods we are going to follow. So I'm going to explain you in detail about all these. These are the Purva Karmas. First is Pachana, Sneha, and Svedana. So why we have to do? To prepare the body and mind to detoxify. If without doing Purva Karma, yes, we can do, but the results will be very minimal. We may not able to take all the toxins away, and the results may be minimal to maximum, variable. One stretch when we go for Dana Karma without Purva Karma. Next slide. This is what I have mentioning. What are after Purva Karma? What is Panchakarma? We are going to do Vamana, inducing emesis, Virechana, inducing purgation, then Nasya, installation of medicated oils to the nasal canal where it absorbs and reach for upper respiratory and upper part of the body. Then Rakta Mokshana, bloodletting, and Vasti, the enema. Different medicated enema we are going to give. One oil enema, another is the decoction enema, and a third type for a female we have a Uttarabasti, we call it as, and it can be oil or it can be decoction. Next slide. This is where I stopped in the last class. Let's see in the Purva Karma. Under Purva Karma we have three procedure. One is Deepana Pachana, Snehana, and Svedana. So what is Dipana? Dipana is nothing but digestive and Pachana is nothing but carminative. So see how Ayurveda explains each and every disease is manifested because of variation in the digestion and metabolic factor in an individual. That is what Ayurveda Acharyas have mentioned long back, stating this sloka, which have taken from Ashtanga Hridaya Nidanasthana. Roga sarve api mandagno sutara mudarani cha ajirnat malinai cha annai jayante masanchayat. What it means? Roga sarve api mandagno sutaram udarancha. That means every disease is going to manifest just because low agni. That means manda agni, weakened digestive system can lead to all the diseases. Example, udara. Udara is nothing but a disease manifest for the abdominal condition. Then ajirnat malinaicha annai jayante malasanchaya. That means if take food during weakened digestive system, it is not going to convert into a nutrient factor, rather it's going to be a toxin which circulate across and leading to plenty of diseases, which we call it as a mala. Anna will become mala, not as nutritional factor. Ajirnat mala, that means undigested food material can lead to toxin. This is the sloka. That means Deepana, digestion athwa digestive, Pachana, carminative is very important therapy. What we advise before Purva Karma, whoever it is, whoever undergoing Panchakarma procedure, it is a mandate to understand their Agni Bala, then Jirna Bala, then Roga Bala, then Rogi Bala. So understanding all these first, Agni Bala, we are going to understand. Based on that, we are going to start Deepana and Pachana, which involves the oral administration of specific medicines which kindle the Agni and which improves the digestion activity. Deepana refers to application that ignite Agni. Agni is nothing but the metabolic factor, digestive factor within every individual, which we call it as a fire, without necessarily digesting Hama. Deepana is nothing but just keeping the digestive fire, and Pachana is nothing but the the toxin produced. Other drugs classifies also as digestive. That means digestive will not do Pachana, whereas Pachana drugs will do digestive as well, focusing on the digestion of ama without significantly intensifying the Agni. Next slide. So what it does, how it's going to happen, how our drug is going to act on body is very important. See, Ayurveda majorly focusing on the revision of Agni and Ama. Agni is the metabolism and the digestion. Ama is the toxin produced because of the indigestion. When digestion is not happening properly, it can lead to or it can produce a lot of toxins. So Deepana therapy serves to enhance the Agni. So it kindles the Agni digestive fire. So thereby contributing to the disruption of pathological condition linked to the Manda Agni. That means whatever the disease is going to manifest because of the Manda Agni, that is less or weakened digestive fire, will be corrected there itself by taking Deepana Dravyas drug. So what it does, kindles the restorative fire within the body and re-establishing the sound health by restoring the balance of metabolism and the functions. So how it starts? Deepana ignite the digestive fire first, then it can activate the glossopharyngeal nerve, then it stimulate the vagus nerve, which is responsible for its action at stomach level, and stimulate the fundus and pylorus of the stomach for its action. This is what scientifically how digestive drugs can help in kindling the digestive fire and taking food for its metabolism and digestion. Next slide. The Pachana, the carmine. Once the digestive has done a job, that is kindling the fire, then what Pachana is going to do? That means Pachana drug does in improving the digestion of the food material. Now it is ready for digestion. Digestive fires are there. Food has been given. Now it's going to improve the digestion, and which is not leading to production of ama. When the digestion is happening properly, when your body feels light, your food digested, no ama is going to produce. That is, toxins are not produced. So it helps in reducing the production of ama, improving its activity. which is called as Pachana. So how Pachana Dravyas does its action? Activation of the vagus nerve, thereby promoting the secretion of gastric juices. Then it trigger the duodenum, leading to the secretion of digestive enzymes. Then it also stimulates the liver, increasing the secretion of bile and boost the secretion of pancreatic juice by stimulating the pancreas. This is modern way of interpreting our Pachana or the carminative of the drugs. That means digestion or digestive has its own role, carminative has its own role. See, if someone is having disturbed digestion, is not feeling hunger, his appetite, if his appetite is very low, is not interested to have food, then we have to give digestives. Whereas appetite is good, he is able to eat food, but it is not digested, then we have to give carminatives. That's the difference. Feeling hunger, ready to eat, I'm eating, but I'm not able to, then carminative. I'm not feeling hunger, I'm not interested, I'm not taking any food, then digestive. That's the difference. Digestive is the kindling factor. Carminatives are the metabolic or digestive factor. Next slide. So these are the herbs having common, common herbs having the properties of digestive and carminative properties. Example, ginger, both wet and dry having digestive property. Long pepper, black pepper, cumins, ajwain, ingu, garlic, coriander, chavia, it's an herb. Chitraka, again, it's an herb. Ballatak herb and even our, lavanga, clove, bay leaf, all are digestive and carminatives. Among these, few are very digestive. For example, to say ginger is a very good digestive, long pepper and pepper are digestive, cumin is a digestive, ajwain is a digestive as well as a carminative. Some of the herbs act exclusively digestive, some of them does both the job, digestive as well as carminative. And the formulations from Ayurveda which does digestion and carmination are Ingu Achadi Churna, Ingwadi Gulika, Chitrakadivati, Pachala Shunadi Kashaya, Pipalyasavam, Vaishwanara Churnam, Ajamadadi Churna, these Ingvashtaka Churna, these are some among common formulations we are using in our practices to improve digestion and carmination of an individual who are interested to undergo Panchakarma procedure. You can see the pictures. That is a long pepper, then that is akoras, and that is ballataka, then chitraka white flower, then the black is the chavya one and the ginger. These are some of the examples we are using on day-to-day basis to treat or to improve the digestion and metabolism before he undergo Panchakarma procedure. Next slide. Yeah, before getting into oleation or snehana, how many days we are going to do Deepana and Pachana is very important. For example, if the person is having weakened digestive system, we are going to have up to 7 days of Deepana Pachana. If the moderate weaken, then 5 days. Mild weaken and is able to eat and is able to digest his food, 3 days. So we are going to select based on the prakriti of the individual, and we give 3 days, 5 days, or 7 days, depending on the requirement, having common ingredients and common herbs for kindling his digestive fire. To the next topic under Purvaka, Snehana, oleation therapy. What is Snehana? Sneha means which is sticky in nature, which attracts, binds, we call it as Sneha. Like our oils are Snehana because it gets to or attracted to body. So oleation therapy is one of the most important therapy. How many of you have taken a single Abhyanga or massage? Once you undergo that massage, feel that relax, you get it. Nowhere you can against that. That is the specialty of Ayurveda Abhyanga. It's one of the most important therapies that prepares the body to receive specialized Panchakarma treatments. Once you undergo the oleation therapy, body is ready to detoxify. That is what we are going to see as Sneha Snigdha Lakshana. That means body is ready for detoxification. It involves the application of medicated oils, ghee and herbs to the body internally and externally for 3-7 days. Depending on the requirement of each and every individual, we do Snehana for 3 to 7 days. If it is required 3 days, if it is required 5 days or 6 days, depending on the chronicity of the disease, age of the patient, and agni of the patient, and as well, number of Panchakarma procedure we are going to handle. Then Snehana is crucial as it loosens Hama. It loosens the Hama to get away from the body, and also it start balancing the doshas and also expulsion of other metabolic toxins, what we call it as ama. Okay, so this is important stage of Panchakarma where Snehana or Snehapana or oleation therapy we do, and it is very important before we do Panchakarma. Next slide. Types of Snehana. One is Bahya Snehana, external. In the last slide I have shown you the massage, you are taking external application of oils on body. It's called as Bahya Snehana, external. What it does, it brings all the external toxins to body and expels some of the things. It is expelled externally when we give Svedana therapy after Snehana. Then Abhyantara Sneha, internal oleation, giving medicated ghee or medicated oil for 3 to 7 days to soften the system and also bring all the toxins for its expulsion is called as Abhyantara Sneha. That means giving patient to drink medicated ghee or medicated oil for stipulated period. It can be 3 days, it can be 5 days, or it can be 7 days. Sometimes it can even up to 9 and 11 days to bring Sneha Siddha Lakshana. Until that, we're going to administer medicated ghee in Arohana Krama. Arohana Krama means increasing the dose every day. For example, if I starting the dose, started dose of 30 ml on the first day, second day we are going to do 60 ml, 90 ml, 120 ml, like that. If the patient Agni is good enough and his age, it come under Madhyama, then we may start at 50 ml, 100 ml, 150 ml. So internal Abhyantara Sneha to solve the system. Both are aimed at channelizing and collecting the toxins within the body. So Abhyantara as well as Bahya Snehana is very important to cleanse the body as per or required for Panchakarma procedure. Next slide. This is Bahya Sneha or Bahya Snehana, external oleation, what we call it as Abhyanga. Some of you might be asking, what's this massage, different kinds of massage? Ayurveda has its own authentic way of telling external massage or Bahya Snehana to detoxify. Even simple, without undergoing Panchakarma, this can also lead to a lot of detoxifying procedure, just having Abhyanga for yourself. So that's why we advise every patient who comes to us, every guest who comes to us, at least to experience one Abhyanga so that externally it is detoxified. Classical reference, when you look into the Ashtanga Hridaya Sutra Sthana, it says Abhyangam Achare Nityam Jara Shrama Vataha Dushti Prasada Pushti Ayu Swapna Sutvak Dadyakrit. That is, what are the benefits of Abhyanga? Why we have to? Abhyangam Achare Nityam. That means every day you have to have external oleation. That is the sloka talks about. That means it's a mandate to every individual to have oil massage at home itself too. For what? Jara, Shrama, Vataha. Jara means anti-aging. Shrama means relieving the exhaustion. Vata is reducing the water in the body. Drishti Prasada Pushti. That means it improves eyesight. Pushti, it rejuvenates the body, increases the longevity Ayu. Then Swapna, it induces good sleep. Sutvak, and it is good for skin. Dhadyakrit, it builds the body stamina and the physique when you undergo Abhyanga. These are the importance of massage at home itself. So what kind of daily self massage can we do? Yes, Tila, that is ginger is enough. Pure gingerly oil, pure tilataila, take from the market, warm it, make lukewarm, not heating directly. Indirectly, we have to heat by keeping our oil in a small bowl, in bigger bowl of water boiling. So indirectly, oil become warm. Then take gentle, massage by yourself. At least foots and hands and head, which can rejuvenate your body, and at least part of the benefits can be attributed when you have yourself Abhyanga. If you get an opportunity, at least 15 days once or monthly once, you please take Abhyanga in authentic Ayurveda centers to have all the fits to yourself. That is Abhyangam Achare Nityam Sajara Shrama Vataha Drishti Prasada Pushti Ayu Swapna Sutvak Dadyakrit. That means it has so much of benefits to the body, not just a relaxing massage. Beyond relaxation, lot of things it's going to attribute to your body. Next slide. Swati?
Next slide.
Yes. What is Abhyanga, if at all, if I ask as a general question for colleague? I'm just talking perspective of Ayurveda. On that, I just also mentioned exactly for the common understand Abhyanga. Abhyanga is a deeply therapeutic Ayurvedic massage. Different ways, different strokes, different style, and where to start, where to end, everything's explained in the literatures of Ayurveda. It's not just a fun-filled massage, it is beyond that technique involving the application of warm herb infused oils more than a physical treatment. It is regarded as an act of self-care, self-love in Ayurveda, nurturing the body, mind, and spirit. It nurture everything. When you experience Abhyanga at an authentic center, you will start feeling lightness in your body and you will start feeling better yourself. This practice stimulates marma points. When trained therapists do Abhyanga on our body, it stimulates the marma vital points, vital energy points, which really stimulates and give a lot of energy to the body, promoting the flow of prana, life force, and encouraging both vitality and emotional well-being. And truly, it's going to be a transformative, holistic impact at on multiple levels of health and balance. So once you experience this Abhyanga is not just a massage; it is divine Ayurveda way of nurturing your body, mind, and spirit is Abhyanga with warm hands of a therapist or a healing hands of the therapist. So once you get an opportunity, even I request everyone at least to come to our School of Ancient Wisdom and experience Abhyanga with therapeutic Ayurveda oils with trained therapist giving on authentic way of you know preparing yourself to detox just with one Abhyanga will do for you. Next. So what are the benefits of Abhyanga? Just to put in a points like this, I'm just going to put it like 5 points other than the shloka points. I'm going to explain you the shloka points each. Stress relief. It's just simple technique without much spending and taking time. You can relieve your stress. Rhythmic strokes. It calms down the nervous system and reduce cortisol levels and
I don't know if Dr. Kumar's screen is frozen, but I'm not able to see him talk. Is it my connection or is it Dr. Kumar's?
sorry,
Please
I
join
lost
back. Yes.
in between. Enhanced circulation. Our body is a network of circulation, and because wear and tear, because of age, because of the pathology, because of infection, because of inflammation, there may be a lot of variations of or blocked circulation. To improve the circulation, simple Abhyanga can enhance and it stimulates the blood flow, improving the oxygen and nutrient delivery to the point or to the site where required, supporting detoxification and energizing the entire body, thus by our Abhyanga. Then skin nourishment. Many of you be worried why my skin is like that, why it is not snigdha, it is very dry, very it has lost its elasticity as age advancing, wrinkles, everything will be overcome by simple Abhyanga with authentic way of doing and authentic oils using. Hydrate and rejuvenate the skin every time and reduces the dryness, wrinkles, flakiness, and leaving it soft, radiant, and youthful. Abhyanga does. Then lymphatic detoxification. Abhyanga facilitates lymphatic drainage. Always it cleanses, helping removing the metabolic or remove the metabolic waste by doing strokes on body, and it does strengthen the immunity and increase the vitality of the individual. Then dosha balance, as oils are too good, snigdha is too good to balance vata, and also it does balancing the pitta and the kapha by taking the combination of the herbs within the oils. It is nothing but overall health improves, then support the emotional stability, better digestion, and good cognitive function of Abhyanga. These are the benefits of Abhyanga. Next slide. Deeper understanding, when I put it, it can be 4 points. Restful sleep. Many people struggle to have a good sleep because of a lot of personal, professional, issues
Yes.
comes. From all these, please go at least fortnight once or monthly Abhyanga. It does restful sleep that reduce pains and stiffness. Body is undergoing a lot of metabolic stress because of our eating habit, lifestyle, stress, because a lot of inflammations. Because of the inflammation, there will be always pain and stiffness. To overcome that, Abhyanga can be a good, uh, what I can say, good interventions where you can reduce pain and stiffness, because it does a lot of volume and reduce the stiffness, and it can improve chronic lifestyle disorder, so it can reduce inflammation. Then anti-aging property. If someone wants to live long without or healthy aging, I can call it as, to have a healthy aging, please have Abhyanga. It does supports the regeneration, and it also does improve vitality of the skin, so they start feeling better and feeling young every time through Abhyanga. Then it's nothing but boosting immunity to individual. When we have all these corrected by ourselves by just doing Abhyanga, it can enhance the immunity and defends the body by reducing the infection, and also it improves the ojas. We call it as Sarvasara or Sarvadhatu Sara is ojas. When all the tissues are well aligned and well functioning, you will have good ojas, and it can lead to vitality, and which is nothing but the immune factor or boosting the immunity. Next slide. So traditional, as per the shloka, what it does, Abhyangam Achare Nityam, that shloka, it is Varna Prada, enhances the complexion of the individual. It is Tvak Adya Karta, that means maintains the skin firmness. The tonicity of the skin is maintained well, and the elasticity. Then Vadik Shamatva, that is strengthen the immunity of the individual. Tarahara, that means slows the aging process, what we call it as a healthy aging. Then Vatahara and Kafara, balances Vata and Kapha dosha in the body. Then Abhighata Saha reduces trauma related effects in the body. Then Klesha Saha mitigates the stress and anxiety. Then Shramahara, exhaustion will be, fatigue will be taken care. Then Balavan, it increases the strength of the individual. Then Dhatu Pushti Janana, that means it does Pushtikara of Sarva Dhatu in the body. This is Ayurveda view in explaining from the literatures how Abhyanga can benefit to individual. Next slide. Types of Abhyanga. There are three types of Abhyanga we carry out, and every Ayurveda, authentic Ayurveda centers carry out. Sarvanga Abhyanga, full body massage. It may take 40 minutes to 80 minutes, depending on the type of oil we are using and the chronicity of the disease, and required from the patient too. That is full body massage, Sarvanga Abhyanga. Then Shiro Abhyanga, head massage. Especially when it required, we go for Shiro Abhyanga or head massage. It takes 20 minutes to 40 minutes. And Pada Abhyanga, foot massages, 20 minutes to 40 minutes. Again, different oils we are using for different purpose, and each have its own therapeutic application, not just treating the disease, also preventing the disease and relaxing the individual to have happy, healthy, and long live. Next slide. Coming to so far we have heard about external foliation. Now Abhyantara Sneha, internal foliation. What is that? What it means? That means we're going to administer medicated oils and ghee for each individual who comes for Panchakarma. That we call it as a Sneha Pana. Sneha Pana can be 3 days, 5 days, 7 days, or 9 days. Even sometimes we may go up to 11 days, depending on the gut of the individual, depending on the Snigdha Lakshana after taking Girta, we assess and we'll take a call whether we have to finish for 3 days, 5 days, 7 days, or 11 days. So standard treatment remains like this: 3 days, 5 days, 7 days, 9 days, and 11 days. It also take it for consideration that the age of the patient, chronicity of the disease, and digestive or the gut factor of the individual. Then how we do Abhyantara Sneha? Why we do? Again, as I mentioned, all the metabolic toxin has to bring it to the GI tract once we give oleation therapy. It can be medicated oils or it can be medicated tea, which does the lubrication and prepares the body for subsequent detoxification procedure, what we call it as Panchakarma. It is nothing but oral administration of medicated ghee every day, one time, early morning, before we take anything, for stipulated periods: 3 days, 5 days, 7 days, 9 days, and 11 days. On an average, it will be 3 to 5 days. Next slide. So once we do Snehana or Sneha, as Purva Karma, then next is our Svedana, the third one under our Purva Karma. First was Deepana Pachana, second was the Snehana, third is Svedana. Svedana is nothing but sudation therapy. Now we have done internal Snehana, external Snehana. We have to sweat it out, which we call it as Svedana. Svedana or sudation therapy involves inducing sweat in the patient. Why we have to? We have to open the sweat glands, pores of the skin, to take away the toxins externally after doing oleation externally. It channels ama or pent up the toxins inside the body to place from where that can be easily ejected by system of Pradhana Karma. So it is usually conducted as the last stage of Purva Karma after our Pachana and Snehana, but it is important as a standalone mode also we can go. In the next version from the naturopathy, you can see different types of sauna and to cleanse the our Sweda Srotas and cleanse the body external channels. The Svedana is cleansing cum stress relieving therapy recommended for suffering from ailments, asthma. We use salt therapies. It's also part of sweating therapy. Weight and digestion issues. Weight, to lose your weight, again we go for sweating therapy, and improving the digestion, we go for sweating therapy. Other than undergoing Panchakarma procedures. So this is Svedana. Next slide. Types of Svedana. There are 6 types of Svedana explained in the literatures of the classics of Ayurveda. We do follow, and they are Pinda Sveda, Navara, Kili. That is not a soft, bolus of is prepared and putting on the body after heating, which we called as a Pinda Sveda, Navara, Kili. And second is the Ushma Sveda. Second, you can see that second picture, the person is sitting in the box, only head is up. That we call it as a Ushma Sveda or Bashva Sveda, where sweat is induced by giving our what vapors or herbs added into the water before it evaporates. Then third is the Avaga Sveda, where the person is going to in hot water or medicated water with the herbs, where sweating is going to induce. And the fourth is the Nadi Sveda, where it connected to the or the the steam produced, then very particular part of the body will be given, which is a Nadi Sveda, or we also use it for across. Anaha Sveda, a paste is prepared out of medicinal herbs, warm or make it lukewarm, apply on the specific part of the body, sweating is induced to that part of the body. And then last is the Patra Sveda or Ilaki, that is nothing but Patra Potali Sveda, prepared out of the herbs, made a potali and make it and apply on the body to induce sweat. So these are the different methods of sweat mentioned in the literature, and we do follow in our hospital. To follow Pinda Sveda, Bashpa Sveda, Avagaha Sveda, Nadi Sveda, Upanaha Sveda, and Patra Pinda Sveda. So we do follow in our hospital inducing sweat for individual. So what it does during all Svedanas, the sweat inducing agent is carefully directed to the surface of the body where we want to induce. The movement gently dislocates the toxins inside and channels them to specific sites. So it's helping to cleanse externally and channelizing the route to cleanse the toxins externally. Next slide. What are the benefits of Svedana? It purifies the tissue, eliminates the toxins, detoxifying the kidneys. Other than Panchakarma, I am talking, not just aiming for one. It regulates the action of each and every organ, liver and respiratory system, and improves the circulation, relieves the stiffness, improves the digestion, and removes the blockage of strotas or the channels, any obstructed or accumulated. Svedana karma in Ayurveda can also remove excess body heat once we open the sweat glands, and that means it can also reduce the body temperature, clear the channels of the body to improve circulation, helps in easy breathing, reduces the water retention, and excess weight can also be reduced using this therapy. It's not just a simple therapy, it is widely applied or applied across different diseases and its management. And there are contraindications for Svedana. It cannot be given to pregnant women, people bleeding disorders, alcoholic, people who are very thin or very fat, not able to withstand the heat of the steam, and people with the diarrhea, and then anemia, and then jaundice, dizziness, fever, and other such ailments. It is contraindicated. We cannot take it everyone. So we have to see the condition of the patient, and we have to see the conditioner or the disease. Then accordingly, we have to take for Svedana therapy. Before we do Svedana, we have to do Snehana, but some of the cases without doing Snehana also we can take it for Svedana, where it can help in overcoming the disease or reducing the signs and symptoms of the individual. The skin and the body. Yes, this is the Purva Karma of Panchakarma. So far I have explained. Next class onwards, I'm going to do Panchakarma, Mana, Rechana, and then Nasya, Rakta Mokshana, Basti one by one. If one or two in each class, try to finish each in one class. The size of the subject, maximum to deal and explain, but I'll try to do it either in next 2 or 3 classes. I'll try to finish Panchakarma lecture. Yes.
Thank you, Kumarji. So if anybody has any questions, please do ask. Because I have a question. So before I ask, if anybody else has any questions, either type in the chat box or please ask. So while others are thinking about the questions, Kumarji, I wanted to check with you. You said regarding Abhyanga, when you spoke about Marma points, and we have to self-massage ourselves while having a bath every day, before having a bath every day. Where are the Marma points? You mentioned to massage at least the soles of your feet, your hands, and your head. So where are the Marma points that we can apply this warm gingerly oil on?
See, when you're
your screen is frozen. Let me turn my video off.
Please don't look into Marma points and massage because so.
Sorry, I wasn't able to hear you. Your screen froze momentarily. Could you please repeat? I don't know if it's my connection or if I'm not able to hear you or see you.
Am I audible now?
Yes, now you're audible and visible. Again, not audible or visible. It's again gone blank, Kumarji. No, still don't have any connection.
Sorry.
Swati, Am I audible?
Yeah, you are audible now.
Yes, I can hear you, Kumarji.
When you do yourself, please look into generally yourself. There are special Sharma points to address. For example, Sadhya Pranara Marma, one which leads to vital parts of the body. The Kalantara Marma, like the difference of marmas I have explained across the body, marma points.
Okay, so we don't have to worry about marma points, is what you're saying. So basically, we just
not at all.
okay, fine. But just for our awareness, where are these marma points? Is it a very complicated system? Sorry, lost you again. It looks like your connection is unstable.
Yeah, unstable. Sometimes it disturbs.
Yeah, maybe you can just turn off the video. At least we can hear you then.
Yeah, I'll do that.
Yeah.
Now, yes.
It is better now. Yes, I can hear you clearly.
Yes.
You were saying? You were saying that we don't have to worry.
It is not required for you to know marma points to have Abhyanga by yourself.
Understood.
In
Understood.
our case, in our office Abhyanga, do general Abhyanga, not marma Abhyanga.
Understood. But where are the marma points, out of curiosity? Is it like the meridian system?
Okay. Somehow it is a part of meridian system, but beyond that we have, for example, marma in our hands, marma in our foot, marma in our thigh, marma in our region, marma in our head, marma in our nose, marma in our chest part. Across we have.
So when we had Manikam ji, who was a Varmakala expert, did he speak about, did he give more clarity on this marma points and how it can be used? Because it looked like he was very effective with relieving pain and restoring balance.
Yes, there are experts treating exclusively by touching points for the chronic disease, even in case of traumatic or non-traumatic injuries, and it helps in healing by reducing the pain and the inflammation. Pain and inflammation is the important aspects to address the patients, so it does.
Thank you, doctor. Actually, many things that you spoke about are very interesting, but this being a very short satsang today, since tomorrow is a Varamahalakshmi Puja, people are all busy for it. We don't have that much of time, but once again, I throw the floor open to people who might have any more questions.
Namaste. I just wanted to know, like,
Namaste, Ramamaniji.
Issues also can be addressed through Panchakarma.
Which one, madam? Can you repeat?
What health issues?
Health issues like depression, anxiety, all those things can it also be cured with Panchakarma?
Yes, madam. Yes, very much.
Okay. If somebody has that, like say body pain or head pain or something, even then they can take Abhyanga?
Yes, that's what I'm telling. Abhyanga is a part of Panchakarma. Abhyanga is also part of Panchakarma because Abhyanga can its own a treatment protocol where we advise to treat any disease, even Panchakarma.
Thank you. You gave a lot of input about Panchakarma because I see lots of ads which says book an appointment for Panchakarma and all. But you're telling it is a 7-day or a 9-day process prior to that, which is really surprising. because I don't know what others are doing, because they say come and book an appointment and get it done. So what's your call on that, sir?
See, madam, yeah, because they are attract the public to get an insight on Panchakarma. Panchakarma has become a very fancy word now, and are knowing about as a word, but not knowing much about Panchakarma. How do they do? It's a challenge. So that's the reason whoever comes to us, will brief them, make them to understand. Please don't ask Panchakarma. Present yourself. What is the issue? Will advise Panchakarma for you.
Yeah, actually, yeah, now that I don't think so. Like whoever listening cannot be cheated just saying Panchakarma, come and get it done and all. Thank you very much for the beautiful insight, sir. Namaste.
Yes, madam, the class is please join next class also when I present, because now I started finishing the Purva Karma. Now actual Panchakarma has to start one by one all the 5 procedure. Hopefully when you
I
hear
will
from
do
me,
that,
you will
sir.
understand more on the plan for it.
Yes, sir, I'll do that. Last week also I attended. I won't miss this, sir. Thank you.
Thank you, madam. Thank you so much.
Thank you, Ramanaji. Anybody else? Any more questions? Okay. So that brings us to the end of today's satsang. Very interesting series on Panchakarma that Dr. Kumarji is making us aware of. This is actually knowledge from our ancient wisdom. And as we are exposed to this knowledge, a lot of hidden information is now coming out to us, which we were not made aware of earlier. Like just the simple process of what seems to be like a simple process of identifying whether the food is properly digested or not, and how to handle food that is not being digested properly, itself can start transforming our health by helping our bodies start their self detoxification process. So this is a very natural approach compared to disease management. So this kind of approach, the biggest difference that we see here with this Panchakarma and Ayurvedic approach is that it is managing people and not the disease. And that is the beauty of our natural systems, which we must spread. So more power to Kumarji and his team. Thank you so much, Kumarji, for introducing us and making us more aware.
Thank you so much. Looking forward again in the next class.
Likewise. So now we come to the last section of our satsang today. Of course, I mean, need I add that on behalf of the School of Ancient Wisdom, we thank Kumarji, who is a part of the School of Ancient Wisdom. So it's like an internal thank you. So let us all sit straight in this space of gratitude for the Loka Samasta. Sit straight with your back, neck, and head aligned. Think of your loved ones. One name that comes to my mind is our dear friend and fellow Satsangi, been a part of our family for a very long time, Lalita John Ji. Let her regain her full health and vitality at the earliest. Let us send our waves of healing for her good health. And also, please remember your loved ones, whatever ailments they're going through that you want them to overcome, and send out these prayers to the world at large, to the universe, of love and truth. Let love and truth prevail. Please sit straight with your back, neck, and head aligned. Take a nice deep breath. And let go. Observe the silence within, the language of the soul that connects all of us to our higher selves and to each other. Loka samasta sukhino bhavantu. Loka samasta sukhino bhavantu. Loka samasta sukhino bhavantu. Om Shanti Shanti Shanti. Om Tat Sat. Brahmarpanamastu. Thank you, everybody. Until next Thursday, same time, same space. Please do get your friends along in this very interesting series. Take care and God bless. Hari Om.